Hello everyone. So, this is MDEH first year class. We are studying subject called clinical anatomy. So, these classes will be done in Hindi and English both simultaneously. So, in previous classes, we discussed three topics, very important topic related upper limb. So, uh, I, I will, I think everyone will know what is upper limb. So, if you know that what is upper limb, please message it or chat it in the chat box. So we discussed about shoulder joint, elbow joint, and wrist joint. In the shoulder joint, you will get number of cases regarding frozen shoulder. Okay, so this is the most common clinical condition which will come to you into a clinic. So you have to diagnose it very perfectly and treat it. Okay, the same condition with tennis elbow. It is the most common cases, clinical cases, and as well as carpal tunnel syndrome. So before treatment, if you know the general anatomy, along with general anatomy means normal condition when you are in healthy state, how your body structure is there. Okay, clinical anatomy means when the changes occurs in anatomy structural changes occur in the body, then the body shows you some symptoms and as well as signs. So when patient come to your clinic, we'll do a simple examination. With that examination, you will able to find out the cause of the structural or cause, or simply you will diagnose the condition. So it is clinical anatomy. So after that, you can easily treat the patient, manage the patient. Some things are manageable, something need treatment. Okay, something needs something. Okay, based upon the cases, the management will change. Okay, so in previous classes, we discussed three topics, very important topics. So I will also send the new person who will join. Okay, they will watch it and they will know about the cases: frozen shoulder, tennis elbow, and carpal tunnel syndrome. Today, we will also discuss one important topic, that is the cervical nerve compression. This is an important topic. So, we will discuss the cervical nerve compression. Before that, what is cervical? Okay, what is cervical? I will explain you. And whatever nerves are coming from the cervical region, we will discuss. And then, not comprehension, sorry, here spelling mistake, compression. So basically it is topic related to neurology. Okay, so here I will explain about basics only. Okay, basics and important things which are important to related to clinical anatomy. Okay, so let's start the topic. So आज हमारा टॉपिक है सर्वाइकल नर्व कंप्रेशन. सो हम लोग देखेंगे सर्वाइकल क्या है और क्या क्या नर्व्स वहां से रिलीज होते हैं और कंप्रेशन कैसा हो सकता है. You can see this is the vertebrae. This is vertebral column. What we will call? This is called vertebral column. Vertebral column. Okay. In that, the first part is called cervical, which is near to the neck. You will have seven bones here. And then the middle part is called thoracic. You have 12 bones here. And the after middle part, you have lateral end part, that is lumbar. You have five bones here. After that, you will have another bones, five bones, fused bones. Those are called sacral bones or sacrum. They have five bones or you can call it one bone. It fused together, you will call one bone. Singly, you will call five bones. And end bone, that is called tailbone, or coccyx bone, it is called one bone. So total you will have 12 plus 7, 19, 19 plus 5, you will have 24. If we call one bone 25, this is 26. Okay. Either you will call 26 bones of vertebral column, or if you added 5 bones, it will become 30 bones. Okay. 30 bones. And you can see this is in the skull, we have brain. In the skull, we have brain. And here, what present in the vertebral column? This is called spinal cord. This is called spinal cord. Both brain and spinal cord are called central nervous system. They are both our central nervous system. Okay. From the brain, from the spinal cord, some nerves arises. Okay. Some nerves arises. From the brain, you will have 12 cranial nerves. Okay. Like this, we will discuss when the neuro clinical anatomy will come. So we'll discuss Bell's palsy, trigeminal neuralgia in detail. Okay. So from the skull, 12 cranial nerves arises. From the spinal region, spinal cord region, spinal nerves arises. Spinal nerves arises. Because this basis, if you don't know this basis can concept, we are not able to understand other things. So from the spinal cord, the nerve arises. From the skull, the nerves are arises. So those nerves we will call as peripheral nerves. What we will call peripheral nerves. So they are leaving the central nervous system and going towards the body. Like in the hand, you have one nerve. So this nerve is called peripheral nerve. In the legs, you have a nerve, femoral nerve, tibial nerve. Okay. So what we will call as peripheral nerve. Okay. So this is about the basics of cervical spine and spine, basically spine. So if you come to the part of spine, in the cervical spine, this is the cervical region. This is cervical spine. So here the cervical one is going to start one, then you will be able to so two, three, four, five, six, seven. Okay, you can see this is C1. This is the from side view. Okay, like this. This is from posterior view. Okay, some X-rays will be done anterior view. Okay, so lateral view, posterior view, and anterior view. So before examine the bones or anything, sometimes we needed cervical X-ray. So okay, X-ray needed. So to know the structures of the bones, mostly nerves cannot be seen in the X-ray. This is C1, this is C2, this is C3, this is C4, this is C5, this is C6, this is C7. Between them, the nerves have arises. You can see this is C1. In the between C2, the one nerve is going here. Here also one nerve is going. One nerve is going. This is going to attach here. This is like this. This is like this. This is like this. Okay. So you can see from this foramen, this hole is known as foramen. One, two, three, four, five, six. Here. So these nerves are coming outside. This is called spinal nerves. Bones are seven, but nerves are eight. So that's the reason we have 31 nerves, spinal nerves, 12 cranial nerves. This is the basic things. Everyone should be know that. You can see from the sagittal section. This is called sagittal section. Okay, one vertebrae is taken, and their structure is showing here. Okay, you can see this is the spinal nerve. This is the spinal nerve. This is the disc. Okay, this is the spinal cord. So what will happen in spinal cord compression? Mostly in the cervical. If you take any part C4, C3, mostly the cervical compression occur in between C4, C5, C6, C6, C7 sometimes, but mostly C3, C4, C5, C6. What will happen? This sometimes the bone, the vertebral bone having inflammation. So there's the reason it will compress the nerves. Okay, it will compress the nerves. What will happen? Like, so you have only one position. Like you're working like this. Every time you will write this. So some students will like work like this. You're using mobile phone like this. Sometimes someone will put like their head like this. Okay, so based upon their structure of the neck, okay, based of their work, depend that the condition. Okay, so what will happen? The vertebral column, this disc, sometimes it will come outside. Okay, because of severe functional disturbance. Okay, you are doing functional disturbance, so there is a reason the structure is changing. So sometimes what will happen, if you hit like this one time, two time, three time, it's okay. But if you hit like this is function. You are hitting 100 times, 1,000 times, 10,000 times. What will happen here? Gradually, you will get some issues. Here, soft tissues are damaged gradually because of hitting pressure. Same thing happening here. So due to the excessive pressure, functional pressure, the structure is changing and the disc is started coming outside. Sometimes what happen? You are giving immersive pressure by lifting a weight. Like your body is capable to lift 15 kgs, 10 kgs. That's it. Okay. You are lifting 30 kgs, 50 kgs. What will happen? The pressure will divide and it will affect on the vertebral column. Okay, so then the disc will come outside and it will pressure the spinal nerves. Okay, spinal nerves. Then what will happen? Which spinal nerve is affected? That area will give the symptom. That area will give the symptom. So this is the basic anatomy. Okay, next come to these are the nerves: C1, C2, C3, C4, C5, C6, C7. These are the spinal nerves. This is called. Mhm. So these are the nerves. Okay, already I shown you. Now come to the part, clinical part. Very important. Neurological assessment and myotones and motor function. So a person come to your clinic with the neck pain. Okay, neck pain, and he's telling 4 to 5 symptoms. He's telling I have pain here. Okay, whenever I am lifting the head, I am getting pain here first. Second, then I have numbness in the fingers. Middle three fingers are numb. Okay, and they have pricking sensation. They have pricking sensation. Okay, and another symptom is numbness. Means there is a heaviness in the hand whenever lifting. So these are the 3 to 4 symptoms the patient came to your clinic. Now, clinically, how do you examine the patient? How do you understand in the cervical region where is the exact problem? So this is your clinically clinical case. You have to understand. Okay, the person maybe go to the neurologist and he will come to you. Then what? Then you will study how you can There is the written, there is a nerve compression, etc., etc. But how do you identify? As a doctor, you have to know he checked according to his knowledge, according to his professional. But your duty is also there. You have to check. You have to re-examine. You have to gain confidence from the patient. What will happen? The electrohomeopathy doctors, what they will do? They will diagnose according to the other doctor. Okay, they will confirm the diagnosis. They will not do the diagnosis. Okay, then according to their diagnosis, they will write the prescription of electrohomeopathy remedies. So how this is this fair? I'm asking the question. Is this fair? So what's your duty? You have to re-examine the patient. You have to reassessment the patient, and you have to identify where is the root cause. Okay. So this is called clinical anatomy or clinical examination. So before that, you have to know that these nerves are coming and they are inserted in different areas like this. So these are called nerves. These are called nerves. So we'll call brachial plexus. So the nerves are coming from cervical and entering into this area. This is called apex. Okay, shoulder apex entering. So you can see this is the shoulder apex. Okay, you can see this is called shoulder apex entering into that area. From that, they are entering the brachial plexus and they are dividing whole and entering into the lateral part, medial part, and they are going into the wrist, hand, arm, forearm, and wrist like this. Okay, dividing, going that like this, and entering into the limbs. So, which nerve is affected? We have to know the basic idea. So, you can see that this image help you a lot. I think so. Hmm. This image will help. You can see that. So from here, the C3 is going to start. So here two terms you have to remember. One is dermatomes and one is myotomes. What is myotomes? Myotomes means a single innervation of nerve to the particular muscle. So one example I will give you, that is deltoid muscle is here. This is deltoid muscle. So single one nerve is going to insert there, and it is the basic duty to do the function of the muscle. Okay. Okay. One nerve is coming. Okay. And the function of the muscle is happening due to the one nerve. So this is called myotones, muscle tone. And dermatone. Dermatone is one nerve is inserting into the particular area. Okay. And you are feeling sensations, touch, uh, touch, and uh, temperature, pain. Okay. So these are the sensations. Okay. Sensation you are getting from that area and it is taking away from that area to the cervical cord or spinal cord. So those are called dermatome. Okay. And myotomes. Dermatomes and myotomes. So I hope you are getting my points, everyone. If any doubts, kindly message me or chat. You can have chat box. Okay. So here is written everything. Okay. If any doubts, kindly ask. Okay, no doubts. Okay. A myotone is defined as a region of skeletal muscle inverted by single nerve or a spinal cord level. Okay. So I explained the thing. Because most skeletal muscles receive innervation from multiple spinal levels. Clinical evaluate myotones by testing specific joint movements. So we have examination one. Okay, what is the examination? One is shoulder abduction. If you want to see any problem in the C5, okay, C5 level, C5 level. So what you have to do? You have to shoulder abduction. So we have four types of or six types of movement. Okay, this is adduction. You are adding. This is called adduction. This is called abduction. Your rising hand, abduction away from the body, and this is called extension. Extension, extension box. You know that you are moving away from the uh, main circuit, what main area. Okay, where you put the plug, everything. Extension, like your hand is moving away. Okay, any extension you are doing extension like this. Okay, another one is flexion, means it is also bringing back to the original position. Okay, like this. This is flexion. This is called extension. Okay, this is called adduction. This is called abduction. And some joints have different movements, like medial rotation. That is okay. This is lateral rotation. Okay, and you are going to 360 degrees, medial, lateral, everything like bowling. Okay, this is called 360-degree rotation. Only shoulder have 360-degree rotation. Okay. So now you are doing shoulder adduction, shoulder adduction. This is called shoulder adduction with the help of C5. With the help of C5 means you are doing okay adduction. It means the C5 is okay. Next, forearm. This is the forearm joint at elbow. Flexion. Flexion again. Flexion. This is flexion. So you have to tell the patient like this, bring this hand, means C6. Okay, C6 doesn't have. If he is unable to bring the hand, means there is an issue in the C6. Next, C7, elbow, from the elbow. You have to do extension. Extension from C7 and flexion from C5, C6. This is C6, this is C7. And this is C5. Okay, abduction, C5. And next, C8, finger. This is finger flexion, finger flexion. Like this flexion, this is also flexion. And C5, again C5, we have finger abduction. This is abduction. This is adduction. Oh, sorry, this is abduction. This is adduction. This is abduction, and this is adduction. Okay. So these are the clinical examination we have to remember. So by this, you will able to understand where is the actual problem in the cervical region. You have to do this examination to the patient whenever he come to your clinic. So these are called myotones. You can see in this image easily. Okay, this is C4 area. This is C5. Okay, this is C6. This is controlled by C6. Okay, this is C7. Is three fingers, or middle three fingers. Okay, and this is C8 area. This is C8 area. Okay, this is T1. This is T1. So what are the functions we have here? In the C1 we will do cervical flexion. You can see cervical flexion. Cervical flexion means this is flexion. This is flexion. C2, C2, cervical extension. This is C2. This is lateral flexion. C3, shoulder glide elevation. C4, shoulder abduction I shown. Elbow flexion I shown. Elbow extension. Thumb extension. Thumb extension. This is thumb extension. Finger adduction. Finger adduction. This is adduction. This is abduction. Flexion. Okay. And these are the simple things we have to remember when we are doing clinical examination. Lower limb, we will discuss in lower limb. Okay, lower limb things. This is also dermatomes. C4, this area. C5, okay. C6, C7, C7, C8, T1, T2, and T3. These are the nerve names. So we will not discuss here because they are related to some examination. If there are three main important nerves which are coming into the upper limb. Okay. Those are called medial nerve, radial nerve, and ulnar nerve. Means if a patient have any issue upon this nerves, okay. So you have to do test. Test by asking the patient to adduct the thumb. Inability indicates a problem, lesion, any issue. It is thumb. Okay, what he have to do? He have to do adduct the thumb. Adduct the thumb. Adduct. Oh, sorry. Adduct. It is adduct. Adduction. This is adduction. Okay. Abduction. Adduction. Abduction. Next means there is a problem in the median nerve. Here, median nerve is going here. This is radial nerve. This is ulnar nerve. Okay. I hope everyone is going to understood this. Mm. Next is radial nerve. By asking the patient to extend the wrist, extension means okay, he is doing okay. He is not doing means there is an issue in the radial nerve. Ulnar nerve, by asking the patient to adduct and abduct the fingers. Adduct and abduct. Adduct and abduct. If he is doing, is okay. If he is not doing, means ulnar nerve issue. Okay, so this is about the testing of the median, ulnar, and radial nerve. You can have the things related here. I explain whatever is there. It is here in the diagram. You can uh, go to the diagram also. Dermatome also I explained. Okay. So dermatome is an area or strip of the skin innervated by a single spinal nerve. Okay. Single spinal nerve. Diagnosis. Uh, Here I told you the dermatome, the sensations. What are the sensation? Like complete loss, no touch, no sensation. You are pricking, you are telling there you're keeping a hot bottle there, hot water, anything. There is no sensation. His hand is not moving. Means the complete loss of the sensation. Okay, sometime paresthesia. It's like abnormal sensation, like tingling, numbness. Okay, means there is a disease in the spinal cord area. Disease in the spinal cord area. Okay, dermatome. Movement and dermatome is very, very important. You can see these are the dermatome area. In this area, this C3, C4, C5, C6, C7, C8, and T1. Okay. So any tingling sensation, numbness, anything is there means there is issue in the spinal cord. Okay. So this is all about the spinal cord compression. Okay, spinal cord compression, cord compression. SCC. I hope you understood. Uh, Treatment. What? How we can treat? This is the main question. But before that, we have to diagnosis. We diagnose that there is an issue in the spinal cord segments. Now, which nerve is their problem issue is we diagnose. But what type of disease is there? So again, it is related to the neurology. This part is related to clinical anatomy, but that part is related to neurology. So here we have to know the neuroanatomy, neurophysiology, neuropathophysiology. And these are the things we have to know. Then only we will able to diagnose. Okay. So this is the second part which is related to other subjects. So whenever the topic will come, we will discuss there. But here simple treatment, they are the most common two topics which will come in the spinal or cervical cord compression, that is cervical spondylosis. Cervical spondylosis or cervical disc prolapse. Disc prolapse means cervical spondylosis is the inflammation in and around the cervical bone, cervical vertebrae. In any part 1, 2, 3, C3, C4, C5, C6, C7. Cervical disc prolapse, I shown you the disc. The disc is coming outside from its area and it is compressing the spinal nerves. So we will discuss this in the clinical cases that there from that point of view, we'll discuss the treatment. Here, the regular treatment we will do the patient, we will treat from the to the patient, that is S5, B, okay, C4, N1, GE, and third one is for pain, F1, A3, C5, R, and fourth one is compression. Compression may be RE, Y alternately. Okay. Ointment or oil, or directly you can apply D3. Okay. So here you will initially you have to apply cold compression, then gradually you will go to the hot compression. Inflammation is there. Always remember cold compression. If there is no inflammation, only pain, means you can apply hot compression. Okay. So it will give great results. I treated lot of patients of spinal cervical spondylosis, intravertebral disc problems. So you have good results. This is a regular treatment, but according to the diagnosis, pulse diagnosis, tongue diagnosis, and iris diagnosis, you will give the reason behind the cause, behind the problem. Because electrohomeopathy is about the lymph and blood. So these symptoms you have to match with the organ, and organ gives you the reason. What is the reason? So you have to check the pulse. They will get the organ. So patient have cervical spondylosis will have 4 to 5 organs like liver issues. Due to the liver issue, he have problem according to electrohomeopathy. Okay. According to electrohomeopathy, there is an issue in the stomach, small intestine, large intestine. Thus, there is a spinal cord happen. It may be also possible if a person have direct involvement of spinal cord. Due to the spinal cord issue, he have nerve compression. So reason is different. So treatment also change, slightly change. Okay. Slightly you have to add, slightly you have to give the treatment. Okay. So this is all about in today's class. I hope you understood. So anyone have any doubts, kindly ask. So after that, I will again record for Hindi session. If anyone want to join, they can join.